It was a pretty easy choice to choose wax. I think that I get really good experience and exposure here. It really rewards people who are proactive and want to learn. You get very close access to senior doctors. They're very supportive. You get opportunities to a wide range of procedures. You're not just tucked away in the back of the room.
We wanted Albany Hospital in particular to be really expert at training what we call rural generalists. What matters is that they are sufficiently skilled to be able to work in a region where all sorts of things come through the door. What we need is people who can deal with the broad range of stuff that comes through the door in an efficient manner and not have to send people to Perth all the time.
I think they care more about your development as a person, as a doctor here. You sort of feel like a valuable member of the team and your input's taken on board and you just get that experience a lot quicker. So I was seeing patients in ED, helping out in theatre, working in clinic as well, essentially doing sort of tasks you wouldn't get to do in the city for years.
Because our seniors are supportive and present on the wards, if there are things happening that we need help with, they're really good at coming and giving us a hand.
So one of the difficulties with general practice is it's been difficult to get exposure to primary care as a junior doctor in the pre-vocational space. So we have several John Flynn Junior Doctor Program positions at Pioneer Health. The initial positions were women's health focused primary care and community care JMO position. So next year we'll be moving on with the addition of 3 more John Flynn Pre-Vocational Doctor Program positions there, expanding their roles within the community practice, including residential aged care facility visits, home visits, and working alongside GPs and GP registrars in the primary care role. These new positions offer a junior doctor the opportunity to revisit general practice without signing on to a training program necessarily, which they may not have had the opportunity to do since being a medical student.
We support them absolutely in terms of accommodation. All of our accommodation places have Wi-Fi, for instance. We support them in terms of financial support to get here. There's personal and professional development leave that they can take and they get financial support for that as well. Each of them, when they come as interns, will have a buddy for the year. So that will be a second or a third year graduate resident, and that'll be for the whole year. So there'll be a person who's very close to them in age who they can go to and say, look, I really don't know how to do this, can you help? And they will. So we set that up.
You get, in one rotation, the opportunity to see so many different diseases because none of our rotations are super specialised. You get chances to work up patients yourself in ED and admit them, and you get the opportunity to see what happens with them down the track when you're back on the ward.
I love that it's really hands-on and that the seniors down there are really excited to get you to learn and get you to kind of be hands-on and give you the experience that I think sometimes you wouldn't get in a bigger hospital.
There's something about the pace of life that's maybe a little bit slower, a little bit more relaxed. There's enough things here, there's still access to shops and you can get back to Perth if you need to. It's far enough away that it's definitely just a different pace of life. Beach is 5 minutes away, all of the hikes are 20 minutes away. There's enough things here and enough other friends and colleagues and opportunities for things like sport that you don't feel like you're missing out on some of those things. But you definitely know that you're in a smaller place and that really gives it a nice feel.
It's a beautiful place, both in and out of the hospital. So out of the hospital, just gorgeous community, gorgeous environment. In the hospital, you just learn so much and it's just such a safe and supportive environment as well. Early on in your career where you're trying to figure out what you want to do, this is a perfect place to figure that out.
The photos don't do it justice of how beautiful it is. You can just explore somewhere new every weekend or day off. And the hospital itself, welcomed with open arms. They were so accommodating.
I think I'm living the dream. Albany's the best place.